Hi guys. So let's start with the question of the day. So the question goes like, asbestosis of lung is associated with all of the following except A. Mesothelioma, B. Asbestos bodies in sputum, C. Nodular lesions involving upper lobe, or D. Progression of lesion even after stopping exposure of asbestosis. So this is a very important topic, that is pneumoconiosis. Pneumoconiosis, I have seen this topic being repeated more commonly in INICT. So in this question, first, these are my notes of path. So what are pneumoconiosis? Pneumoconiosis is chronic fibrosing lung disease due to inhalation of organic or inorganic particulate and chemical fumes and vapors. So asbestos, there are two types of fibers in asbestosis. First is the serpentine fiber and the amphibole fiber. What is serpentine? As the name suggests, serpentine is something that is wavy, curly and flexible fibers. So it accounts for most of the asbestos used in the country. And what is amphibole? Amphibole is straight particles. These are more pathogenic. Amphibole is more pathogenic. It with respect to more, it has more malignant potential than serpentine. So first is this asbestos. What will be the history given? History will be given of some mining, fireworks. Next, very important, all that coal worker, pneumoconiosis, silicosis, they all will involve the upper lobe. Asbestosis, in the name it will say asbestosis, base. It will involve the base, that is the lower lobe. What can be seen in asbestosis? What are the lesions which are associated with asbestosis? First is pleural plaque. It is the most common manifestation of asbestosis. Second is interstitial fibrosis, pleural effusion. Third, it is bronchogenic cancer. Which bronchogenic cancer? From A, you can learn from A, chronic asbestosis leads to adenocarcinoma. It can also lead to squamous carcinoma, but more commonly it will lead to adenocarcinoma, and more specifically it will lead to mesothelioma. So two questions will come. First question, which cancer it is associated with? It is associated with adenocarcinoma. More specific or asbestosis, it is mesothelioma. These are two individual questions which have been asked in your exams. What is Caplan syndrome? Caplan syndrome, it means pneumoconiosis with cavitating rheumatoid nodule. In Caplan syndrome, we have this thing that it is only associated with coal worker pneumoconiosis and silicosis. No, it is associated with all three of them. And I used to learn like this. One more question comes. Which spine or vertebrae are involved in rheumatoid arthritis? I used to learn like it was C2. It was actually cervical vertebrae. So from cap you wear on the head upside. So cervical vertebrae are involved in rheumatoid arthritis. Just a correlation, and it is also a PYQ. So what things we have understood? Asbestosis, that is two type of particles, serpentine, amphibole. Amphibole is more pathogenic. It involves the base, that is the lower lobe. It is associated with pleural plaques, lung fibrosis, pleural effusion, interstitial fibrosis, mesothelioma, which is more specific, and also associated with adenocarcinoma more commonly than squamous cell carcinoma. Now, TB risk. It is associated with more commonly with silicosis. So these are all the point about asbestosis. Today we will discuss about asbestosis. Now one more important point. What is this interstitial fibrosis? In interstitial fibrosis, you can see some asbestos bodies. What are these? These are iron containing material which is coating the asbestos fiber. So it will look like this. And also you can see it looks like a dumbbell shape. As iron is more strong, so it will look like a dumbbell shape. And a ferruginous body. This is also very important. So these are important points about asbestosis. And Caplan syndrome I have also explained. Now let's come back to the question. Asbestosis of the lung is associated with all of the following except. Yes, it is associated with mesothelioma. It is more specific. Asbestos bodies in sputum. Yes, it is seen. Nodular lesion involving upper lobe. No, it involves lower lobe. Asbestosis. It will involve lower lobe. Progression of the lesion even after stopping exposure to asbestosis. Yes, progression of lesion occurs. That is why even after 25 to 40 years, you can see bronchogenic carcinoma and mesothelioma in patients with asbestosis. So these are important points. Now I have asked one more question related to asbestosis. This was also a previous very old AIMS question. Just wanted to tell you that AIMS very often ask questions from pneumoconiosis. All of the following features are seen in asbestosis except diffuse pulmonary interstitial fibrosis. Yes, pleural thickening, nodular lesion involving lower lobe. This was one of the option. In this question, they have just changed this option. From lower lobe, they have written upper lobe. That is why we need to solve previous year question. And emphysema, no. The answer is D, emphysema. Why? Because emphysema, it is associated with smoking. It is nowhere associated with asbestosis. So, this was the question of the day. Answer of this question is C. That is, it is involving the lower lobes. Thank you guys. See you tomorrow with another question. And for that pedigree question, I would take one small video on pedigree itself. There I will tell you the answer of that question.